Hi there, I'm Colin Receiver. Thanks for joining me on part 2 of our 5-part series about the power of online video. Today I want to talk about quality because terrible online video can actually cause you to lose potential patients. When I come back, I'll explain why. Today, we're talking about the top 5 ways to make terrible online video. I said the terrible video can cause you to lose patience, and you might have scoffed at that thought. But think about it this way. If you saw a really cheesy billboard advertising a real estate agent, would you be more or less likely to give that guy your business? Probably not. Probably less. Consumers are used to seeing quality advertisement and videos around every corner. If you can't keep up or you're not keeping up, it's going to be evident to just about every potential patient checking out your website. So let's take a look at 5 things that are going to ruin your video. Number 1, your video has a terrible environment. Quality video begins with a quality setup. I'm talking about the background of the video, the lighting of the person in the video, and the sounds that can be heard on the camera. Don't take video with a drill running in the background and lots of environmental sounds that are going to distract at best and scare at worst the person watching it. A video needs great lighting, an inviting background, and sound quality that is pleasing to listen to. Number 2, you look like you don't know how to operate a camera. You can't pick up just any digital camera and expect to get great video. Quality video happens with quality equipment being run by someone who knows what they're doing. Just as you are a good dentist, there's good video operators out there and there's bad video operators out there. The last thing potential patients want to see is shaky video that you took with your cell phone. Remember that running the camera is only a fraction of the job. You need someone that knows how to correctly edit the footage and put together a cohesive message. Terrible editing is just as bad, if not worse, than terrible camera work. Number 3, your content's too clinical. The content of your video should be something easy to understand. Patients know you're the doctor. You don't have to prove you're a doctor in your videos. Speaking about procedures and health information so that anyone can understand it. Don't make difficult procedures sound difficult. Make them sound simpler. You're going to gain your patient's trust. You're going to appear confident. Just remember, no one likes to feel like they're being talked down to. Number 4, the content isn't useful. On the opposite end of the spectrum, let's talk about content that doesn't have any use on your website. There's no reason to make a video about how to brush your teeth or how to hold a toothbrush. You have to find a happy medium where your content is engaging without being too clinical or too obvious. And finally, number 5, you don't take it seriously. Above all, if your online video looks like you haven't put forth an effort, people are going to know that. It's going to be glaring. Patients are looking for practices that are willing to put their best foot forward. Is that you? Does your content reflect that? I'll leave you to think about that until tomorrow, when we're going to come back and talk about using great content in your video. Until then, keep moving forward.